Hi there, my name is Amarnath. Today I will be presenting on Gefitinib, which is also known as Iressa, as a marketed drug. Gefitinib therapy as a part of a precision medicine. Gefitinib drug discovery and development was done by the AstraZeneca. It is a quinolone derivative designed to selectively inhibit the tyrosine kinase activity. It is available in the form of pills with a 250 mg, and it is a oral small molecule drug, and it is developed through the medicinal chemistry screening of quinazoline compounds tested in the in vitro kinase assay, then validated in the cancer cell line modules through the growth inhibition. This rational drug design made Gefitinib one of the first tyrosine kinase inhibitor to enter the clinical trials. Here comes the mechanism of action and the overview. The epidermal growth factor receptor is a receptor tyrosine kinase belonging to the ERBB family. When activated by the ligands such as TGF alpha, it triggers the signaling through the MAPK pathway, mitogen activated protein kinase, and the P13K pathway, also known as um, ion cited 3 kinase, protein kinase B. These regulate the proliferation, survival, and the differentiation and in cancers such as lung, breast, colon, and ovarian. EGFR is often overexpressed or mutated, and this is a link to the aggressive disease and the poor prognosis. EGFR can be detected using immunohistochemistry for protein overexpression or the molecular testing such as PCR or sequencing of identifying the mutations. Um, Coming to the treatment part with the patients, when patients have a EGFR mutations or overexpression, they can be treated with the treated therapies. The two main approaches exist: the small molecule tyrosine kinase inhibitors, such as Gefitinib, and monoclonal antibodies such as um, Sutimexib, which blocks the receptor externally. By matching the drugs to the patient's EGFR profile, response rates and survival can significantly improved as compared to the chemotherapy alone. In vitro key results in a preclinical experiments, Gefitinib was tested in EGFR positive cells lines from the colon, breast, and ovarian cancer, as we discussed in the previous slide. The results showed the dose-independent inhibition of growth in soft agar. At a lower doses, the efficacy was mainly cytostatic, meaning the halted proliferation of the cell. At a higher doses, Gefitinib uh, induced a two to four folds increase in apoptosis. Importantly, when combined with the chemotherapy drugs such as cisplatin, paclitaxel, doxorubicin, Gefitinib produced a supra-additive effect. Apoptosis increased 2 to 3 times more than the either treatment of doses. The in vivo key results studies used in the human colon cancer xenografts in nude mice. When treated with Gefitinib alone, there was a clear dose-dependent inhibition of tumor growth, but tumors resumed growth once the treatment stopped, showing that the efficacy was reversible. So the graph which is shown here, however, when the Gefitinib was combined with the chemotherapy against the paclitaxel, topotecan, and ralitaxel, the results were much stronger. The tumors were arrested. The survival was prolonged. For example, when the combination therapy, 40 to 50% of mice were still alive at mm, 10 to 15 weeks after a tumor injection, compared with the all control mice dying within the 4 to 6 weeks. So mm, the figure 8 in the paper significantly shows this figure illustrate about the tumor and the volume reduction, and the survival benefits, making it the most powerful visual from the paper. So these findings highlights the importance of precision medicine by screening the patients for EGFR mutations or the overexpressions. So the clinicians can identify who will benefit from the Gefitinib. These targeted therapy approaches improves the survival, avoids unnecessary toxicity in the patients unlikely to respond, and personalize the cancer care. So the Gefitinib became one of the earliest proof of concept for the drugs, showing um, how much molecular screening are targeted and therapies can be transforming outcomes in the oncology. So for the conclusion sake, EGFR is a critical oncogenic driver that can be detected through the molecular and the protein-based assay. So Gefitinib was developed as a selective EGFR inhibitor using a rational drug design in a preclinical testing. It showed a strong efficacy in vitro and in vivo, particularly in combination with chemotherapy. Most importantly, Gefitinib represents a milestone in precision medicine, demonstrating how matching the targeted therapies to participate profiles and can be significantly improve the outcomes. Thank you for listening.